Thank you for joining us. One of our major concerns in life is that of our health. And our guests today are Professor Dr. Orion Lee Tulp, President of USAT, the University of Science, Arts and Technology in Montserrat College of Medicine. And later in the program, we have Dr. George Einstein, Professor and Dean of the university's Einstein Institute, and they'll both tell us about the academic programs and what is unique about this university following these messages. With us now is Dr. Orion Tulp, President of USAT. It's a real pleasure to have you with us today, sir.
Pleasure to be here, sir.
So it's an interesting world we live in, with technology influencing the way academia survives in this world and actually progresses enormously. Tell us a little bit about how you see distance learning as opposed to the way it was in the past.
Well, I see many changes coming, and the changes that occur in medicine are a little different than they are in other disciplines. In medicine, for example, we can't call it distance learning. It has to be a remote classroom, and all of our lives, the lectures have to be live lectures in medicine. And that, the medical boards and the credentialing agencies kind of get wrapped around the axle about that. They want to make sure that they haven't lost that one-to-one intimate quality between the professor and the student. So that's a major change, but that's changing the way that we deliver medical education, especially in this century, because gone are the days, or disappearing are the days, when you had the traditional classroom filled with students and one professor going on for several hours a day, because in today's world it doesn't quite work that way. You have to accommodate the needs of the student, the needs of the profession, and meet those in a timely manner so that you can deliver the product, educate the physicians of the next century, and train the leaders of the next generation.
Now, your university is seeing some great success, even though it's actually based in Montserrat, which has experienced some hardship in the past. Tell us what is unique about your university.
Well, what is unique about our university? First, in the Caribbean, we're the only university that is fully internationally accredited through the UK, through the ASIC, which is a highly prestigious accrediting body, and it's the only one really that's available to us in Montserrat. Montserrat, being a fairly small island, like most of the Caribbean islands, wouldn't have the resources to establish its own independent credentialing agency. So we do, being in the British territory, we've elected to do our accreditation through the United Kingdom, because that has prestige and recognition throughout the world. And what is unique about the university is that we use some of the more modern concepts of medical education by having satellite campuses where the students are, rather than having the students come to us. And that's a major difference.
Now, your enrollment is much greater today than ever. Tell us a little bit about your students.
Our students are all working healthcare professionals for the most part. They're all employed, they all are respected in their communities, they're all already developed that degree of professionalism that is necessary to embark on a medical career. What we're really doing most of the time is expanding that in a bridge-type program so they can bridge from nursing, from physician assistant, from chiropractic physicians, from other well-recognized healthcare fields into medicine, and earn the highest of the medical degrees, and in many cases the highest of the academic degrees simultaneously, as we are the only school in the Caribbean that is fully certified to deliver the PhD and the MD degree. And we have currently we have the largest concentration of MD, PhD students of anywhere in the CARICOM, and probably more than most US schools.
And of course, that's very impressive. What are your plans for the future for USAT?
We want to continue to expand our program, possibly opening some additional satellite locations. We're in the process of doing a major campus redevelopment in Montserrat. The architects are busy as we speak, putting together the next generation of academia for Montserrat. And Montserrat is a very unique place because it's the only location in the Caribbean that I'm aware of that has been established, where medical education has been established to be equal to that of the U.S. medical education system. And that is truly unique for a Caribbean school, and we strive to maintain and improve on that standard.
And speaking of unique concepts, an investor who's very interested in working with you mentioned to me that they have an idea, his group, of actually also bringing people from the mainland to Montserrat, to your university, on a cruise ship where they'd have the experience of some lectures on board together with a regular cruise, visit the island for a few weeks and then jump on the ship on the way back. So a cruise and of course an online and on-island experience.
This is a unique idea. It truly is. It has not been done elsewhere. There have been continuing medical education programs conducted on a ship, on a cruise ship, and they're very useful because the physician gets to be away from the world. He gets to update his medical education and do it in a highly credible way while enjoying some time away from the practice. And by tying Montserrat into this, with the new towns that have developed in Montserrat, is a unique, truly unique experience, unlike anything anywhere else.
This is really most interesting. Please tell us a little about the success of your students, your graduates.
We've had tremendous success for a new school. We're just 10 years old this month. We were started in September of 2003. We've just celebrated our 10th annual commencement, during which we conferred 195 degrees. That, as a starter, that is the most of any Caribbean university in 1 year. We have 2 graduations a year. But our graduates on the PhD side, our most successful graduate is now the president and the chief operating officer of a major scientific organization. His company is in the millions generation-wise. He was the first company, he led his first company to the first patent for a human stem cell line, the first FDA-approved stem cell line, and that in itself is very significant. He's been graduated now just 6 years, and to make that kind of extraordinary progress is something to be very proud of, and we are proud of him. On the doctor side, on the medical side, we have a 100% match for our students, our graduates this year. As you're aware, that in the United States, physicians, before they can go into practice, have to do what we call a residency. 3 years of postgraduate training is the standard. And this year we had 100% match. Everyone who applied was accepted. This is the first year that we have graduates that were over the age of 50. We had 2, and both of them got excellent, residency positions immediately following graduation. Our success on the residency match is rather unique because over the course of the last 10 years, it averages 95%. That in itself is the highest of any Caribbean school. And it's interesting that the residency match for U.S. graduates of U.S. medical schools this year, 2013, was 93.3%. So we exceeded even the U.S. graduates of U.S. medical schools. And that is a remarkable achievement for a new school especially.
We recently interviewed a very highly esteemed research leader at Oxford University, and I noticed that the campus is filled with students from all over the world. Tell us where your students are from.
Our students come from many parts of the world, not all over the world yet, but as time grows, they will be all over. The majority of them come from the United States, and many of them are individuals who came to the United States to experience the American dream and have the opportunity to further their education and advance their careers. Their home countries are the Caribbean, Jamaica, Haiti, and other islands. Some from Montserrat. We have Montserrat students on board. They've come from the United States as well, of course, probably more than half of them. We have many from Cuba. We have them from Africa, Central West Africa, several countries. We have them from Europe. We have them from Canada. We have a good contingent that commute to our school from Canada. And that is remarkable that they would travel to our school from an international location. We had one last year that commuted from Spain to participate in our unique program.
Tell us more about your programs.
Our program is unique in the sense that, number one, we have highly qualified faculty, the most highly qualified of any of our competitive schools in the Caribbean. My philosophy on teaching is if the faculty member would not be eligible or qualified to teach in the U.S. system, then they're not going to teach in our system, which means we have some of the most highly qualified faculty. I've been in academia for over 40 years, and the faculty that we have selected are truly the cream of the crop of any university that I've ever taught with, and that includes universities both in the UK and the United States.
Tell us a little bit about the area of difficulty you may encounter sometimes in this competitive world of academia. For example, here at Life Extension Foundation, I hear so much about the discord and controversy that sometimes occurs, unfortunately, in the world while everyone is trying to do their best to further health and so forth. For example, Bill Falloon just wrote this book, Pharmocracy, which he wants me to give you, and I'm proud to hand it to you. And what have you experienced with regard to the controversy that may surround your university along with others?
Our university is unique in the sense that we include in the medical curriculum, we include two major areas that probably should be in every curriculum. One is nutrition. Very few medical curricula include information and training for the physician about nutrition. And that is a major change in our program. The second area that we include is courses in complementary and alternative medicine, because the physician should be the first individual that a patient should come to if they have a question about their medication or their vitamin or their over-the-counter product. The physician should have enough of a background to make a valued judgment of whether it's a worthwhile supplement or not. We present it from the scientific viewpoint. We include only those studies, primarily we focus on the studies that have been scientifically proven in double-blind studies, the same as you would use in, say, pharmacology research or any medical research. So the physicians and the graduates, when they go out in the world, they can tell you about your vitamin, whether it's worth taking, whether it's a good one or a bad one, or whether you're wasting your money or using it wisely. I mean, I think that these are important areas. You have to remember, Richard, that all of your drugs, the major prototype drugs that are in use today and that have been developed over the last century, originated in natural products. And we have some favorite remedies that we use in Montserrat, with our local population to treat things like, say, hypertension. High blood pressure is a major problem throughout the world nowadays, and there are ways to control that, as Mr. Falloon has pointed out. There are ways to control that without reverting to the most serious hardcore drugs and medications that are marketed throughout the world. The physician needs to know the alternatives, because what may be appropriate for one patient may not be appropriate for all patients. And I've certainly experienced the whole gamut of that in my travels and my clinical settings around the world.
Being based in Montserrat, are you subjected to any inhibiting factors that obstruct research, for example, into stem cell research, which occurs in some places in the world, and frankly shouldn't? There should be an open attitude towards new procedures and remedies and so forth.
There definitely should be an open attitude toward, researching. If you can't research it, how will you ever know the answer? And no, there are no stigma against research for stem cells. I've actually worked with stem cells for over 40 years in my research. I've been primarily a researcher throughout much of my career. I've worked with stem cells. We need more and better research and better publications and less bias about stem cells, because I've seen the quadriplegic walk away after the treatment. And these are remarkable breakthroughs that we can make if we can just uninhibit some of that research.
Well, this has been very interesting. I want to congratulate you on the success of USAT. We should do another interview in the near future. Thank you so much for being with us.
Thank you so much for having us.
I'll be right back. With us now is Professor George Einstein. It's a pleasure to meet you, sir.
Pleasure to meet you.
Tell us a little bit about what you do at USAT.
I am professor. I teach biophysics. I teach microbiology, cell biology, and I also develop program on PhD studies, advanced studies with my PhD students, candidates.
So you have the Einstein Institute. Is it named after you?
Yes, it is after me.
So who are your students, and tell us more about your program, please, sir.
This program is unique because I try, through my background, stimulate the immune system in infectious disease, and also right now the new program through my student stimulate the immune system in cancer therapy. I develop mathematical functions, therapeutic mathematical functions, biophysical mathematical function, biochemical mathematical function, and psychoimmune stimulation function. Each functions has matrix of treatment. So everything what we try to do in medicine, integrated medicine, need to have three aspects: biophysical, biochemical, and psychoimmune stimulation aspect. And that is completely different approach what we have right now. We can say that is probably, well, alternative medicine. No, this integrative medicine, because our body has biophysical nature, biochemical nature, and we have great brain, everybody. And brain stimulate all our behavior and stimulate all our health as well, all physiology, metabolism. So, general, we try to treat patients by chemicals, by drugs, but it's not everything. And also drug, it has synthetic nature is different, like drug has natural nature, natural drugs, because the frequency of natural drugs, natural medicine, is different. I give you example. Medicine, penicillin, natural penicillin has wavelengths 16,000 angstrom. Chemical, synthetic penicillin has 4,500 angstrom. So the living medicine, natural, is more powerful. So now doesn't have the toxins. What has the synthetic medicine? So this is different. So life, natural medicine is water, pure water, spring water, pure air, and nutrients. And also, we need to understand that we absorb light and we emit light. And without physicists, we understand the completely different world, what is going inside us, because we emit photons. And my therapy, what I apply with medical doctors, my concept is if we absorb photons, that we emit photons. Chemists usually say photons is secondary product of our body. This is not true. We stimulate by photons our life. We see around in nature. That is my philosophy. And my last, 10 years, 13 almost, I spent on stimulation of immune system by biophysical method and also biochemical method, but use completely different approach. And of course, I did the research research out of United States, on Caribbean island and in Europe. I have publication on stimulation of immune system by biophysics, and also stimulation of immune system by using natural product. But we cannot, let's say, differentiate and say, well, we only use herbs that we can heal, our therapy will be successful. If we only use photons, yes, we can succeed, but need to be together, biophysical and biochemical nature as first. Obviously, I didn't succeed when I used to apply this therapy for smokers, because they have lower oxygenation in their blood. So the battle between viruses, HIV, hepatitis C, staph infection is different when somebody is smoker and somebody is not smoker.
Makes a lot of sense. I would like to ask you about the research you're doing and whether you are obviously aware of the fact that in Israel, for example, they're very open-minded with regard to research at Hadassah and elsewhere. Tell us a little bit of your interaction with colleagues in other parts of the world, specifically Israel.
Well, I'm happy that you give me the questions. 2 years ago in spring in Palm Beach, I met Professor Ido from Palm College of Medicine, Technion University. And he proved me on those time that, that Israel is 10 years ahead in medicine against American success. Because today, this is a future medicine. We will deviate from medicine that if I have cancer, we treat cancer. They right now on the level of, they have matrix, what I also apply in my research, some different matrices for mathematical function, biophysical, biochemical, and psychoimmune stimulation. They develop right now matrix arrays that the different sensors, what I'm also doing that with my student. Let's see, 49 sensors, and through different sensors they can find out what symptoms by breathing, respiration, what kind of sensors, what kind of symptom of cancer is in the body of the human, of the patient. So right now, a little bit, Technion University College of Medicine and Dr. Ido, Professor Ido, has different approach than we have in America. Of course, we have a lot of success, no doubts, but that is their great minds. Well, I was involved also in Star Wars program in America, and I had also great friends in the company when on those time we developed in 82, 86 also special sensors and next for US Navy. So I tell you that future medicine will be prevention medicine, will be completely different medicine. Right now, all world more is working on sensors, and everybody wants to have the group, let's say, arrays of sensors, and you can at home in the future check what problem, what symptoms are in the body of the person. So they are also have right now ability to check the different symptoms. So in the future probably with advanced medicine, no MRI, no tumors, because what will be the special function? Biophysical therapy, different way, biochemical, natural food, and also meditation and relaxing. So they completely will be different approach in the future. And so I admire them, and they asking me for cooperation in certain research, Professor Ido, and we are on the good track.
Very interesting, sir. And leading your department at the University USAT, what are your plans for the future?
We have right now exponentially growing our amount of students of PhD study. So most what I try to cover right now is Professor Tulp, who is president of of USAT, also a research program, because each university who has teaching program, curriculum, and research is a very real university, a strong university, because professors need to give some special example in this area of their expertise, what they offer for students, and create the passion for research for life. And right now, our program is a unique program because we have parallel program, MD program and PhD program, that student in the same time can work on their courses, MD courses, medical courses, and also develop their research. So my right now what I concentrate with my student is immune stimulation by what I mentioned by 3 function, and of course in matrix. That is our work, and I believe that and plus developing new sensors, who let's see with Professor Ido Israel, to have something innovative aspect, different sensors. Obviously, I also have for my students a course, high tech in medicine. So I introduce them everything what is on right now in the current research worldwide, especially in America, in Israel, and Far East.
Well, I must say this is really fascinating. I want to thank you so very much for being with us today.
Thank you very much. It's a pleasure to be here.
Professor Einstein, a real pleasure.
Thank you very much.